Hello, I am Hermes, the AI news of Dr. Edson Freitas. Today, we're going to talk about something that's really important, but also pretty complex: Post-SSRI Sexual Dysfunction, or PSSD for short. And it's a huge paradox, right? This is a situation where the very medicine that's supposed to help people feel better can sometimes create a whole new set of lasting problems for a few.
So right off the bat, a major 2022 review really cuts to the chase. It calls PSSD an iatrogenic syndrome. Now that one word, iatrogenic, is everything in this conversation. It's a medical term that means the condition was caused by the medical treatment itself.
So what does that actually mean? It means the health problem is a direct result of the medicine. And with PSSD, and this is the really wild part, these issues can hang around or even show up for the first time after someone has completely stopped taking their antidepressants.
All right, so let's get into it. What exactly is PSSD? In this first part, we're going to break down the symptoms. And more importantly, we're going to tackle the biggest challenge of all. How do you tell PSSD apart from the depression that the meds were treating in the first place?
And this brings us to the million-dollar question, right? For both patients and doctors. We all know that sexual problems can be a part of depression. So how on earth can you distinguish between a symptom of the illness and a side effect of the treatment?
Okay, so this is where the differences start to become really clear. With depression, it's often about a lower sex drive, but PSSD has this very specific, really telling symptom, genital anesthesia. That's a literal loss of physical sensation. The timing is also a huge clue. Issues from depression tend to get better as the person feels better. PSSD symptoms, though, they can stick around long after the medication is gone, and even when the person isn't depressed anymore.
And it's so important to know, PSSD isn't just about sex, not at all. Its impact can be so much broader, almost like it turns down the volume on a person's entire emotional life. We're talking about things like Anhedonia, which is the inability to feel pleasure from anything, not just sex, or just a general sense of apathy and emotional numbness. It just shows you how deep this thing can really go.
So, all of this begs a massive question. If PSSD sticks around, what is physically happening in the brain? In this next section, we're going to dive into the leading theories that scientists are looking at to try and solve this really complex puzzle. Right now, to try and explain all this, the scientific community is really zeroing in on four main theories.
So what are they? Well, we've got receptor desensitization, an ongoing dopamine-serotonin imbalance, something called epigenetic changes, and even potential damage from serotonin itself. And you know, it's probably not just one of these things. It could absolutely be a combination of them working together. So let's break them down one by one.
First up, receptor desensitization. Think of it like this. Your serotonin receptors are like locks, and serotonin is the key. Taking an SSRI is like flooding your brain with keys, just jamming them into the locks over and over again. Well, eventually, the lock itself can get worn out or even change shape. So later, even when serotonin levels are normal, the key just doesn't fit right anymore. The lock doesn't work properly.
Next, there's the dopamine imbalance idea. Serotonin and dopamine are kind of on a seesaw in your brain. If you push serotonin way up for a long time, it can push the dopamine side way down. And since dopamine is our reward and motivation chemical, that's a big deal. The real fear with PSSD is that the dopamine side of the seesaw gets stuck on the ground and just never fully comes back up.
All right, this next one is really cutting edge. It's about epigenetics. Imagine your DNA is like a computer's hardware. Well, epigenetics is the software that tells that hardware what programs to run. The theory here is that an antidepressant might act like a permanent software patch. It rewrites some of the code. So long after the drug is gone from your body, your cells are still running this new, altered program that changes how your receptors function.
This, of course, leads to a critical question. Most people who take these drugs don't get PSSD. So who does? What makes someone more vulnerable? Let's take a look at the potential risk factors that researchers are investigating. Now, I have to be super clear about this. These are presumed risk factors. The research is still very new, so this isn't proven fact just yet. But scientists are looking into things like specific genes, a person's history with major stress, or even previous use of other drugs known to have persistent side effects.
So you can kind of see a pathway forming. A person might start out with some underlying vulnerability. Then, the SSRI acts as a huge chemical stressor on their system. For most people, the brain bounces back. But for a small susceptible group, their brain chemistry just doesn't reset correctly after they stop the medication. It gets stuck, and that's when PSSD symptoms emerge and, well, they stay.
Okay, now we're at what is probably the most crucial part of this whole explainer. The science is fascinating, but what can you actually do with this knowledge? This last section is all about empowering you to have a much better, more informed conversation with your doctor.
And this is exactly why getting an accurate diagnosis is so important. Listen to this stark warning from the researchers. They're saying that if PSSD gets misdiagnosed as just a return of depression, a doctor might put a patient back on the very same type of drug that caused the problem. You can imagine how that could make things even worse. A proper diagnosis really hinges on your detailed personal history. A clinician needs to know the full story, every medication you've taken, the exact timeline of when symptoms started, compared to when you started and stopped the drug, and what kind of symptoms you're having, especially those key markers like genital anesthesia. All that detail is the only way to rule out other possible causes.
At the end of the day, the goal here is to arm you with solid, science-based information. This is not a replacement for medical advice, not at all. Think of it as a tool to help you ask better questions and have a more productive, collaborative talk with your doctor.
So, what should you bring up? Go in prepared with your full medication and symptom history, especially that timeline. Ask your doctor directly, how can we tell the difference between PSSD and symptoms from depression? And please, I cannot stress this enough, never, ever change your dose or stop a medication without talking to your doctor first. That is absolutely critical.
PSSD is a serious condition, and it is finally, thankfully, starting to get the recognition it deserves. If you found this information hopeful, please share it. Spreading awareness is the absolute first step. It's how we drive more research, create better understanding, and ultimately find effective treatments. Thank you so much for watching.